How to avoid mouth sores and dry mouth if receiving chemotherapy or radiotherapy. While chemotherapy is important to kill cancer cells, it can also affect normal cells in your body. Depending on the type of chemotherapy, organs that may get affected include lungs, kidneys, nerve endings, or the heart. In this video, we will focus on the mouth and go over some side effects related to the oral cavity. The content will cover tips to manage mouth sores, including things related to oral care, cryotherapy, laser therapy, some mouthwashes, as well as tips for preventing and managing dry mouth. This video aims to provide a broad overview of management options for mouth sores and dry mouth. The recommendation of a particular treatment depends on many factors. The type of cancer, location of the tumor, the choice and dose of chemotherapy, and the dose of radiotherapy can affect what works best for you. Talk to your doctor or pharmacist about any treatment option you are considering. So what is oral mucositis? Oral mucositis is the medical term for mouth sores. Oral mucositis is a common adverse effect in patients receiving anti-cancer treatment. It is a painful inflammatory condition and a distressing acute side effect. It affects 20 to 40% of patients receiving conventional chemotherapy, 75 to 100% of hematopoietic stem cell transplant patients, and almost all patients undergoing radiation therapy for head and neck cancer. Why is it important to take care of mouth sores? Mouth sores can be painful and bothersome. Depending on how severe it is, it can make eating and swallowing hard, which can minimize food intake and lead to malnutrition. Also, local and systemic infection could be a complication. In fact, patients who develop mouth sores have twice the risk of developing infections. If your mouth sores are severe, your next dose of chemotherapy could be reduced or delayed. It is important to familiarize yourself with the stages in which mouth sores progress so that you can seek medical help if your symptoms get worse. According to the grading of the WHO, Grade 1, there is redness and soreness. Grade 2, ulcers present and able to eat solid food. Grade 3, ulcers present and requires a liquid diet. Grade 4, ulcers present and feeding through the mouth is not possible. Mucositis is typically self-limited. Following conventional cytotoxic chemotherapy, symptoms typically start on day 7 and peak by day 10 to 14. Mouth lesions spontaneously begin to resolve within several days and are usually completely healed within 10 to 14 days after onset. Severe grade 3 or 4 symptoms may require dose reduction during subsequent treatment cycles. There are some factors that may increase the risk of developing mucositis. These include smoking, poor oral hygiene, younger age, female sex. Other factors that may modulate the severity include pre-treatment nutritional status and neutrophil counts. So how can you prevent oral mucositis? Basic oral care to the mouth is an important practice to reduce bacterial load and prevent infection. Routine actions performed including toothbrushing, flossing, and using mouthwashes. It is recommended to use a soft toothbrush that is regularly replaced. Rinsing with normal saline and sodium bicarbonate mouthwash 4 to 6 times per day may help maintain oral hygiene and improve comfort. The frequency can be increased to hourly if necessary to treat mucositis if it occurs. It is important to maintain adequate hydration. Avoid irritants like tobacco, alcohol drinking, and alcohol containing mouth rinses. Mousses and topical barrier gels can be used to lubricate your mouth. Include in your diet food that does not aggravate the mouth or risk injury during chewing, and avoid eating spicy, sharp, hard food. Professional evaluation and treatment by a dentist, as indicated before cancer therapy, is desirable to reduce the risk of local and systemic infections. Another important technique to prevent mouth sores is cryotherapy. Cryotherapy is the application of ice chips or cold water in the oral cavity. The cool environment in your mouth is thought to cause blood vessels to constrict and therefore restricts the delivery of cytotoxic drugs to the oral tissues. Oral cryotherapy is an easy applied, affordable treatment. Scientific evidence supports the recommendation for the use of cryotherapy for either patients undergoing autologous hematopoietic stem cell transplants with high dose milfalan conditioning protocols or patients receiving bolus 5-fluorouracil chemotherapy. If you are thought to benefit from cryotherapy, your physician will likely ask you to suck on ice chips or rinse with ice cold water 15 minutes before chemotherapy and until the end of the infusion. Another technique used to prevent mouth sores is the use of laser therapy applied inside the mouth by a dentist using red or infrared wavelength. This is a rapidly growing field. It has been recommended by clinical practice guidelines in patients who will undergo hematopoietic stem cell transplantation or patients with head and neck cancer receiving radiotherapy with or without chemotherapy. In one study, the laser was applied in contact with the mucosa on 9 points for a total duration of 12 minutes. Patients received one session daily for about 45 days before they started radiotherapy. Because this therapy requires expensive equipment and specialized operator training, it is limited to centers capable of supporting the necessary technology and therefore not very common in clinical practice. Other studies evaluated the use of honey to prevent mouth sores. A study found that honey delays the onset of mucositis and improves recovery. Take 20 ml of natural honey 15 minutes before radiotherapy. Swish it around for 5 minutes, keeping honey in contact with the lining of the mouth, and slowly swallow. Take honey again 15 minutes and 6 hours after radiotherapy. Although there is conflicting evidence about the effect of chamomile on avoiding mucositis, some studies showed there is a benefit. Chamomile is affordable and accessible, so if you would like to try to make your own chamomile mouthwash at home, these general steps may be helpful. Crush 50 grams of dried whole chamomile flower with a mortar and pestle to powder form. Mix the powder with 500 ml of boiled water. Shake well and let it settle. Sieve the mixture and dilute it if you like. Rinse with your chamomile mouthwash twice a day, 1 hour before breakfast and dinner, for 1 minute each. Benzidamine mouthwash is recommended for the prevention of mucositis in patients with head and neck cancer receiving a moderate dose radiotherapy as well as those receiving both radiotherapy and chemotherapy. Benzidamine is a local anti-inflammatory drug with analgesic properties. Another option is a medication called palifermin. Palifermin is an intravenous medication that is suggested to prevent oral mucositis in patients undergoing autologous hematopoietic stem cell transplant and total body radiation. Discuss with your physician to find out if you are a candidate for this therapy. This is an expensive medication, so its benefits should be weighed against the expense. If you do in fact develop mucositis, these measures can be helpful. Rinse your mouth with a solution of salt and baking soda. You can make this by adding 1/2 teaspoon of salt and 1 teaspoon of baking soda in a quart of water. Use this mouth rinse every 4 hours. Rinse and wipe your mouth after meals. Clean and brush dentures often to remove plaque. Use a soft toothbrush or foam swab to clean teeth effectively. You may use hydrogen peroxide for dental debridement for a short period. Make this by diluting hydrogen peroxide with saline or water in equal portions. Your doctor may likely prescribe pain control medications if your mouth sores are painful, like local lidocaine or morphine taken by mouth if the pain is more severe. Your doctor may also prescribe topical steroids if you have ulcers. Moving on to dry mouth as a side effect of anti-cancer therapy. Dry mouth is more commonly attributed to radiation therapy exposure. However, changes in the function of the salivary gland can also be caused by chemotherapy. Chemotherapy-related dry mouth is typically reversible. The medical term for dry mouth is xerostomia. How to avoid dry mouth? These tips might be helpful. Sip water frequently. Chew sugar-free gum. Suck on sugar-free candy. Avoid caffeine, tobacco, and alcohol. Avoid dry or hard-to-chew foods. Treat dry mouth if it occurs by taking these measures. Rinse with saline. Gargle several times daily with either a weak solution of salt and baking soda that we previously mentioned, or a dilute solution of hydrogen peroxide. You can prepare hydrogen peroxide solution by adding 250 ml of hydrogen peroxide to 750 ml of water. This regimen can refresh the mouth as well as loosen thick secretions. The use of commercially available saliva substitutes can also be helpful. This is the end of this video. I hope it was helpful. Take care of yourself. You got this. These are some of the references that were used if you are interested in reading more about this topic. Thank you for listening.